I was involved very early on. The technology was in its infancy with just an alpha site at Stanford University back in the early 1990s. And I was introduced to the technology by some colleagues. I went up to Stanford and visited the site and visited the company and was intrigued and fascinated by the technology. Here was this system that promised to treat with surgical precision potentially any cancer, any lesion anywhere in the body, and to do this with great accuracy and in a non-invasive way. You had to prove it. It was a promise at the time, and it was a vision, and it was very clever. And I guess I was smitten. I thought that this was the technology to have, and if one were to bet on the future, that would be the direction we were to take. To be involved at a very early stage with potentially very exciting technology that could positively impact the lives of thousands and thousands of people was very exciting to me, and was very motivating. And I made the decision back then that this was something we were going to invest in time, effort, and resources. We have to remember that in 1993, 1994, when NDC first got involved with the technology, the device was not FDA approved. And so we had to work with the FDA under some very tight protocols, and we had to establish our own investigative review board and work under some very tight guidelines. We were limited to treating patients with brain lesions, intracranial lesions, patients who have failed every other modality of treatment, including chemotherapy, conventional radiation therapy, and surgery. And so that was the beginning. That was the subclass of patients that we were allowed to treat to prove and demonstrate that the technology works and that there were enough safety mechanisms guarding a robotic computer-operated device. We had to make sure that the patient's safety was ensured, and we had to prove that the technology works. We came up with a number of protocols and worked together with a small group of committed, dedicated physicians in the community and outside, and collected data, presented the data to the FDA along with, by then, a number of other institutions that joined us. And we were thrilled a few years later when the FDA approved the device and history was made. We started to see a proliferation of such systems throughout the world. And indeed, the dream of one day having a device with surgical precision going after cancer and tumors practically anywhere in the body became a reality.